Hi, today we try to troubleshoot lung diseases, especially asthma and tuberculosis, which affect lakhs of people every year, even more than COVID 19. Now, starting with the mechanism of how ions flow in the channels among the lungs, we all know that partial pressure of carbon dioxide inside the lungs is between 35 of mercury to 45 of mercury. It generally remains 40 of mercury. Now switching to energy level, that is ATP, in the lungs undergoes hydrolysis to form hydrogen ions. These hydrogen ions play the major role in the mechanism of ions flow inside the lungs. Now these hydrogen ions are further carried in the blood in the lungs along with oxygen and carbon dioxide. Now talking about the carbon dioxide volume, 60% of it is carried as dissolved bicarbonates and small amount of carbon dioxide is carried on the hemoglobin as carbaminohemoglobin, which is then transported back to the lungs for exit or removal. Now, we all know that as hydrogen ions volume increases in the lungs, pH decreases because acidity of the hydrogen ions is more and CO2 level also decreases. Reaction can run in reverse direction also. Now these bicarbonate ions binds with these hydrogen ions to produce carbonic acid and convert it into CO2 also. Blood becomes more alkaline at this level because carbonic acid is changes the pH. Now we all know that proteins play major role in any organ of a human being. Here also buffering proteins passively resist changes in pH by absorbing the excess hydrogen ions and releasing hydrogen ions when pH rises. Respiratory system also controls plasma by adjusting carbon dioxide level. Now, hydrogen ions are also being produced by glycolysis and ketogenesis. First, it was being formed by hydrolysis of ATP. Now, this CO2 is carried by the blood to the lungs where it is exhaled. As carbon dioxide accumulates in the lungs, pH of the blood is reduced because of its basic nature. In the asthma attack, you can go for peppermint or green tea. Now coming to the enzymes role, they have separate function in the lungs to form carbon dioxide and water. Now this explains why the CO2 level is less than the oxygen level in a healthy lung of a human being. Now hydrogen ions are further captured by hemoglobin in the blood level and carbonates stays in the hemoglobin, then reaction will stop. So movement of bicarbonates is necessary to maintain the lungs volume. As CO2 enters further in blood volume, especially RBCs. Hemoglobin binds with this CO2 or carried as bicarbonate ions, which has less affinity for oxygen. So this oxygen moves from alveoli to the blood in the capillaries. Now coming to the oxygen volume in the lungs, oxygen binds with hemoglobin to form hydrogen ions, and carbon dioxide level is decreased. This is known as Haldane effect. Unlike the Bohr's effect, where hemoglobin has affinity to oxygen in very reduced amount. So this was ionic movement inside the lungs. And what happens in an asthmatic patient or patient suffering from tuberculosis? These hydrogen ions becomes imbalanced, that is their motion becomes more or less so as to produce the disease. Now coming to the structural level of lungs, between the layers of pleura inside the lungs, fluid helps the two lungs to glide smoothly as the lungs breathe in and out. It is this interstitial fluid which gets leaked inside a diseased person, and thus COPD is caused, that is constructive obstructive pulmonary disease. Coming to the symptoms of tuberculosis, there may be whooping cough, breathlessness, chest becomes tightened, there will be itching in the eyes, energy level goes down, and there may be increased sleep patterns, and in the worst condition the fingers becomes blue, especially seen in the nails of the fingers. Now in this condition of tuberculosis, blood pressure is also lowered, and whereas the pulse rate is increased. Further, more serious condition, diaphragm is pushed down and trachea is diverted to other side, and also lungs get expanded, there is inflammation in the lungs. But the inside of the lungs, the capillaries and arteries, they are constricted, unlike the lung volume. Now the medicines which are considered in lungs diseases, especially asthma patients, Budacort is given, and other inhaler is fluticasone. There is a requirement of mild climate for the survival of the patient, that is she cannot survive in extreme conditions, extreme winter or extreme summers. Now, coming to an interesting fact about women suffering from tuberculosis. Now, drugs are given to a woman suffering from tuberculosis, and in the first year, because it takes at least 2 years for become effective, so it seems that disease has been reduced to a much effective level by proper drug intake and repeated exposure to virus in endemic areas, that is, which are prone to tuberculosis virus bacteria, that seem to be progressively develop resistant to symptomatic infection during the first few years. I repeat, in the first 2 years, the disease seems to get lowered by the regular intake of drugs, and also the repeated exposure to virus in pandemic areas seems to be progressively develop resistant to the infection during this first few years, but say after few years woman is undergoing pregnancy, here comes the drastic change, the shocking condition that the immune responses that could be directed against developing fetus would be fatal, and viruses had become drug resistant. So, some antibody mediated immune disorders, often exacerbated, that is, the immune disorders are increased during pregnancy, or natural acquired immunity is lost. That is, she lost her immunity during pregnancy, and the infection is increases sixfold. That is, infection is increases 6 times, which leads to a much depressive condition called miscarriage, where fetus is not fully developed. So if a woman comes to you and is complaining of peer pressure or seniors pressure or in-laws pressure, she is complaining of miscarriage, either natural or induced, has now become a myth. The underlying condition is the sudden onset of the risk of infection around the time of pregnancy or around the time of delivery. So this is a shocking condition, because in first few years of the treatment of tuberculosis, he or she becomes fit and fine, but as the pregnancy develops, she lost her immunity and sudden onset of infection, which leads to miscarriage or abortion, induced or natural. So this was about lung diseases. Stay home, stay safe. Bye bye.